హాయ్ అందరికీ నమస్కారం. నా పేరు డాక్టర్ శశికాంత్. నేను ఒక సీనియర్ కన్సల్టెంట్ ప్లాస్టిక్ సర్జన్, కాస్మెటిక్, క్రేనియోఫేషియల్ సర్జన్. Primary care in burns. This is the most, I would say, a topic where many people doesn't know what to do. Suppose if a person sustains burns of a hand because of spillage of hot water or sometimes spillage of oil while cooking. This is the most common type of burns that occur any person. For example, most commonly females because they will be the people who are cooking, or sometimes kids because they just before taking bath, generally we have tendency to keep hot water beneath them, and accidentally they put their hand or sometimes they spill that hot water onto them. So these are the most common reasons for the burns, or sometimes accidental, like while doing puja, it gets clothes catch the fire. So what should you do immediately? This is the topic which many people doesn't know. They apply all kinds of things. So what do you do when we want to stop a fire or switch or when we want to put off a fire? What will you do? We pour water. So many people doesn't know that. They maybe, I don't know whether it is illogical or because it is their ignorance or anything, but people don't put water on don't pour water on anything. When you sustain burns, they apply toothpaste, or somebody applies turmeric, somebody applies coffee powder, somebody wrap it with blankets or anything. So apply everything except water. But the most important thing that one must do when they sustain a burn is pour water. Or if you sustain a burns of the hand by spillage of hot water or oil, put your hand or keep your hand under a running stream of water, normal temperature running stream of water. So what happens? So when you put water over the burnt area, it will take off the heat. In that way, the depth of the burns is controlled. This water takes away the heat and decreases the depth of the burn. So if you don't put water, what will happen? A burn which can cause 2nd degree or 3rd degree burns, it will become 1st degree or maybe superficial 2nd degree burns. So there's a hell lot of a difference between a management of 1st and early 2nd degree burns or superficial 2nd degree burns and a deeper burn. So the total management is totally different. So I want to emphasize on one point that whenever there is a burn, pour water, nearest source of water. If you don't have any nearest source of water, then apply something which decreases the temperature. But you don't have any advantage by applying a turmeric or coffee powder or toothpaste or whatever that is available, they will apply. So first thing that we should do at any time when a person in front of us or nearby who has sustained a burn is pour water. If it is a hand, put it in a stream of water, put it under a tap with a running tap water, or if it is other than that, pour some water on it so that it will decrease the temperature of the burns. So this is the first thing that we should do whenever we see any person who has sustained burns. And after that, we should take him to the nearest hospital where a primary care can be done. If it is a smaller burn, it's a smaller area burn, a dressing will be done, and if it is a bigger area burn, accordingly the management will be undertaken in the nearest hospital. So the first and the primary thing that we should do when a particular person or when a person nearby sustains burn is pour water. That is the most important thing, and many people doesn't know this. Even medical professionals don't know this.